Hey, this is Dr. Kenworthy. We know that coming to the orthodontist for the first time can be a little bit intimidating. In this video, we're going to show you the tools we use to determine if you're ready to start orthodontics. There's a lot of information that goes into developing an orthodontic diagnosis and an individual treatment plan. We look at pictures, we look at x-rays, we even look at a 3D representation of your teeth. So let's go to the computer and I'll show you how we use that information to develop a diagnosis and a treatment plan. Okay, so one of the things that we really can only see in pictures is the health of your gums. So x-rays can show us teeth, the scans of your teeth can show us how crooked they are and how the teeth fit together. But looking at your teeth or getting pictures of your mouth is the only way that we can really see how healthy your gums are. So if you look at this picture, you're going to see, you'll notice these little red areas around the edge of these gums. So those are areas of what we call gingivitis. That's something that we need to take care of before we start braces. Another thing that you can only see in pictures is areas of recession. So if you look at this smile, nice healthy gums, nice clean teeth, but you'll see that this tooth has less gum around it than this tooth does. So that gives us a clue as to where that tooth is sitting in the bone, and it helps me decide how quickly and how far I can move your teeth and still keep the gums and bones healthy. Here's another example of checking gum health that we can't see on an x-ray, and you can see there are some places in this mouth where a toothbrush just can't reach because the teeth are so crowded, and you can see how these gums are a little bit red in these areas also. So those are things that help me decide what treatment options are available and what order we need to do them in. So many dentists will get a screening x-ray even before they send you to see the orthodontist, and usually it looks something like this. This is called a panoramic x-ray, and what it shows us is all of your teeth at one time. So you can see in this x-ray where this tooth looks like it's not quite in the right place. It's somewhere on top of this tooth. What we can't tell from this x-ray is where those teeth are in relation to each other. Which one is closer to the front, which one is farther behind. And we also can't see if there is any damage to either of those teeth, if they are even touching each other or if they're far away from each other. And so while we'll get a screening x-ray like this, we also get a 3D x-ray so that we can look at the whole head and get an idea of where those teeth are. So the amount of information we get in a 3D x-ray is significantly more than the amount of information we get in a 2D x-ray. You can see that this tooth is impacted. It's coming in behind these four front teeth, and this one is slightly impacted too. It's headed towards the roof of the mouth and would not come into the place where that tooth needs to function correctly. Another advantage of our low dose cone beam technology allows us to look at different views of your jaws to look for things like those impacted teeth. So this is a view looking straight up from your chin through the top of your head. So those are the lower teeth, those are the upper teeth, and you can see in this view where those two impacted teeth were that we were looking at in the 3D image. One thing we can notice from this is that where these impacted eye teeth are erupting is very close to the roots of the permanent teeth that are already there. So we can decide how urgently we need to act to preserve the health of the teeth. And the final record that we get is the 3D scan of your teeth. This record allows me to move the teeth to the correct location and see how they're going to fit together before we actually do orthodontics or even come up with a treatment plan. We can decide on things like whether or not we need to take teeth out, whether or not we need to consider surgery, and whether or not we can treat this with aligners or if it would be better treated with fixed orthodontics, braces that are glued to the teeth. So you can see that this person obviously has some need of orthodontics. we've got crowding, we've got some missing teeth, and we've just got some teeth that don't match up with each other. One of the things that we can also do with this program is we can look at just one arch at a time. So we can measure and assess how the teeth need to be treated on the upper arch or how they need to be treated on the lower arch. So I can also move each of the teeth individually and put them in the position where they're supposed to go. And this allows me to see how the teeth are going to move, and the computer will play this in a video. So as we watch this video, you will see how they end up if we put them in the right place. This allows us to see what these teeth look like in the correct position, and we can decide if those are movements that we want to make. And in this case, obviously, we've made some great improvements, and this would be a perfect candidate for orthodontic therapy.
Hopefully, that lets you see how we use the information we gather at your new patient exam in developing a customized treatment plan just for you. If you have questions about anything that we do here at Kenworthy Orthodontics, feel free to give our office a call. Our contact information is going to show up in just a second. Thanks for watching. Rock on.